Can you play basketball with the meniscus tear? We're going to go over some of the things you need to look out for if you want to play basketball with the meniscus tear, and if you can. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist, and co-founder of the Basketball Doctors. All right, guys, let's jump into playing basketball with the meniscus tear. So first, before we go into further detail, let's talk about the meniscus. So the meniscus is the fibrocartilage between your knee joints. So here's your femur, here's your tibia. Around that is your cushion. There's two menisci. We have the medial and lateral. They provide that cushion of the knee. It provides shock absorption, provides stability in the knee, provides nourishment in the knee. So it provides a lot of support there as well in the knee joint itself. So when it comes to these tears, there's two typically ways that you tear a meniscus. So one, you have the traumatic and non-traumatic. So the traumatic is, you stop, you rotate, and you tear your meniscus. There's some kind of traumatic injury, or there could have been some contact, but there was a specific instant which tore your meniscus. The other one is the non-traumatic, over time. And these are talking about the weekend warrior hoopers, the older hoopers, or as you're getting older, the meniscus just gets worn down a little bit, and then you get an MRI and you find out you have a meniscus tear. So with that, we're gonna go over what are the symptoms specifically with that as you're playing basketball. So let's say you have a meniscus tear and your symptoms are locking and catching. So meaning your knee locks up or your knee kind of catches while you're moving through just normal everyday activities. So the reason why that happens is if you picture the meniscus, it's the cushion there, and there's a slight little tear there. So that surface where the knee glides and moves is not as smooth anymore. That little tear is catching, or sometimes that little tear is flapped and it locks your knee, so that causes your knee to lock up. So in that instance, if you have those mechanical symptoms and you've done rehab, playing basketball is highly not recommended, and you might need to have surgery. The reason is that when you're playing basketball and your knee keeps locking up, and let's say you're driving for the basket and the knee locks up, then it might give out on you because the knee locks up and you might fall down to the ground. So that just puts you at risk. So if you have those mechanical symptoms, playing basketball is not recommended there. However, the majority of the time, people don't have those symptoms when they have a meniscus tear. What you need to be doing is, once you do your rehab, where we focus on getting your knee stronger, getting your knee more stable, teaching you how to absorb shock, and then you try to play basketball, and then we have to differentiate between the good and bad pain when playing basketball. You got cleared and you're back to playing basketball. What's going to be the meniscus pain and what's going to be just normal pain? So the big thing is you need to understand that you're going back into this sport that involves a lot of jumping, cutting, and you haven't done it in a while since injuring your meniscus. So there might be a little soreness in the knee, and that's totally okay. That's totally fine, because that's just the body getting used to those movements. And then, just working on the recovery, even just icing the knee right after or adding some compression might help with the knee. And then just figuring out your load management. Maybe you start off with 30 minutes playing basketball, let the knee get accustomed to those loads, then go to 45, then an hour, then slowly build up your time in basketball. However, let's say you're playing and then you start having mechanical symptoms, meaning your knee starts locking up. Then that's the bad pain. Or you have very sharp pain when you're doing certain cuts or certain moves, then that's something that we don't want to be playing through. But if you have some just general soreness or achiness in the knee, especially even after, or you have pain after playing basketball, that's usually okay with us, because that's more over time. The knee just got a little bit overloaded. We just got to manage our load better next time. However, whenever you have these sharp pains, stabbing pains, when you're doing certain movements in the core or the knees locking up, that's when we highly don't recommend you to continue playing, because there's some mechanical symptoms in the meniscus. However, sometimes you might have, one catching event and it just happens randomly and then it doesn't happen again. So we're talking about that consistent catching, consistent locking. So to kind of recap that, when it comes to the meniscus injuries, most of the time you got to figure out first, what are your symptoms? Are your symptoms associated with that meniscus tear leading to locking, catching? That's going to put you at risk when playing basketball and put you in positions where you're not going to be playing basketball, or you're going to be fearful because thinking that your knee's going to lock up or catch up. However, if you don't have those symptoms, you work on your rehab, work on your stability, slowly get into some more movements, and then just learn how to manage your load. You play 30 minutes, you have some soreness, next time play 30 minutes, don't go more than that. And that's going to really just get the knee tolerating the higher loads that you have. Because remember, when you have the meniscus tear, it increases the contact pressures there. You don't have as much support before, so you really have to rely a lot on your muscles to absorb some of the forces there. And you just got to be smarter with that when it comes to managing the load. But hopefully you guys learned a little bit about when you should be playing through a meniscus tear playing basketball and when you shouldn't. If you guys have any questions, or if you tore your meniscus and need help getting back to basketball, comment below or send us an email. We work with people online and in person in Southern California. And hopefully you guys like this video. Share it with friends and family. Subscribe to our channel. And we are the Basketball Doctors. Let's ball for life.